And to a bit of health now, experts are seeking more volunteer donors to reduce shortage of blood in the country. This was one of the discussions at the second National Blood Donor Meeting to celebrate indigenous blood donors in Nigeria. Health correspondent Kemi Balogun has more on this.
Izega Michael has been donating blood for more than a decade. He says his donation started out of a family emergency need, and since then he has donated 76 times.
I had another brother who was a sickler, so every time that he had crisis, we needed blood to transfuse him. And I was too young to donate back then, so we usually go out to cry to people to come and help donate blood for my brother. So when I came to Abuja eventually and the opportunity came, I took it and started donating blood, and since then I've not looked back.
Nigeria has a blood shortage of about 1.5 million units of blood, as it can only account for 25% out of the 2 million units of blood needed each year. To meet the required 2 million units of blood, the National Blood Service Commission says that Nigeria needs about 90 billion to produce the balance of 1.5 million units, and having a lot more voluntary donors will be the first step to make this happen. Experts are here at this event to mark the National Blood Donor Day and appeal that blood donors in the pool can help to reduce this burden and save more lives. The National Blood Service Commission is now set to ensure that this happens by increasing regulations through the commencement of the registration of all hospital blood banks across the country.
Blood and blood products has become an integral part of modern medical practice and is a significant building block for the successful achievement of the health-related sustainable development goals.
This means all hospitals and blood establishments involved in blood services, either public, private, or faith-based, at all local, state, or federal level are required to register with the National Blood Service Commission for effective regulation of their activities.
Over the years, very little has changed in terms of the supply shortage facing the nation's over 200 million population. Safe, effective, and quality-assured blood and its products can contribute to saving millions of lives as it supports complex medical and surgical procedures. It is also addressing maternal health and child mortality, improving care for patients suffering from life-threatening inherited disorders like hemophilia, sickle cell anemia, and acquired conditions like cancer and traumatic hemorrhage. Kemi Balogun, TVC News, Abuja.